In hospitals around the world, doctors are testing new and innovative approaches to fighting cancer, and Gateway for Cancer Research is on the front lines. For more than a quarter century, Gateway has funded more than 150 clinical trials, including the use of mammoglobin A DNA vaccine in the fight against breast cancer at Washington University, a precision medicine approach in the treatment of pediatric brain cancer at Children's Hospital, Los Angeles, explorations into the effects of melatonin on lung cancer patients at the Ottawa Integrative Cancer Center, an innovative approach that uses a patient's own cancer tissue to test sensitivity to drugs at Columbia University, and at Johns Hopkins in Baltimore, Dr. Nilo Azad is studying the effectiveness of azacitidine to inhibit the reoccurrence of pancreatic cancer in patients such as Rukhsana Siddiqi.
To keep going, you need your inner strength, you need God, and you need your family. I was doing pretty well. I worked in a school district as a teacher, and we had gone to a restaurant, and I ate, the hibachi, and then after that I started getting this pain in my stomach area, in my back area, and my brother is a GI. He just said, get a CAT scan. And I got the CAT scan done, and there it was. I was quite numb. I was just so stunned. I didn't know how to react even at first.
After surgery at Jefferson University Hospital and follow-up chemotherapy and radiation at the University of Pennsylvania, Rukhsana came to the attention of Dr. Nilo Azad and her Gateway-funded clinical trial of azacitidine.
80% of people that have pancreatic cancer and have surgery will still recur. So we wanted to adopt a strategy where we could lower that risk of recurrence. And the drug that we decided to use is a drug that is an epigenetic agent. And an epigenetic drug means that it functions to change the actual biology of the cancer cell to make it less likely to spread, less likely to recur, and more likely to respond to chemotherapy in the future if that's needed.
I had to take 3 chemo pills every day, and I was okay. I didn't feel nauseous. I had hardly any side effects.
Thanks to Gateway's support, we've been able to really increase the number of patients that we are able to put on this clinical trial. So we are now over halfway done with the clinical trial, which is very much based on the fact that we've gotten support from Gateway to do outreach. So we call every single patient that has surgery here at Johns Hopkins, no matter where they live across the country, and give them this option of a clinical trial. And we are judging and assessing and measuring with objective measures how people's quality of life is changing, including their fatigue, any side effects that they're having, how active they're able to be. And so that's part of this clinical trial, and it was actually added in because of Gateway's support.
My dream to be with my family, that's my dream.
I just would love to thank Gateway and all of the people that have donated to Gateway for supporting our research.
Save lives. There's nothing more noble than that.
We really think that we are working hard to make a difference for our patients, and we appreciate the support.
I would say that anyone in my position, your families comes first. They are the most important, especially dealing with a disease like this. We want to live in this world for our family. I want to live for my family.